Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with a blocked right ear, as you can see, and it was actually their mother who booked them in, and that's because their mother's a big fan of mine, and ironically, they live on the same street that I used to live on. So they moved in onto that street a few years after I moved out, but we would have been neighbours. So it's quite ironic. And immediately I advised the patient and his mother that this is going to be quite a tricky one. As you can see, this wax plug has been really lodged. It's cemented itself. You can actually see the indentation on the surface of the plug of wax. And even after less than 10 seconds attempting to perform microsuction, I just knew this wasn't going to come out with some further assistance. So what I did was to actually use some sodium bicarbonate drops. Now, the reason for the sodium bicarbonate drops is it would have helped break this wax up a bit more than olive oil, but I left it in for a few minutes, and straight away, as soon as I entered the ear, the outer lacquer of the drops that were sitting on the surface of the plug came away, and then you can see this dry wax again. If the drops was going to be helpful, I'd have to probably keep it in there for 20 to 30 minutes. You can also see at the surface on this wax plug the cotton wool fibres. The patient has been suffering for quite a while intermittently, and I'm guilty as charged. And the patient said, "Us, you know what we're like as men. We kind of not. We don't look after ourselves, and we hope things will just go away." And I totally know where he's coming from. But his mother said he needed to get something done because it was getting worse and worse. And in fact, a couple of nights ago, the patient woke up, wasn't able to hear from this side. So immediately they booked in. And in this procedure, you're going to see me use the ear pick, and it came up trumps. Initially, it didn't, and you'll see in a moment. But so why is this so difficult to remove? And it's so difficult to remove because of, one, the consistency. It's dry. The location, it's right up against the eardrum, and it's actually lodged beyond the isthmus. The isthmus is a medical term given to a narrowing, and in the ear we've got two recognised narrowings. The first narrowing is between the first and second bend of the ear canal. So our ear canal isn't a straight cylindrical tube. I wish it was, because it would make life a lot easier. But we have two bends, and the first bend is located on the about 0.5 centimetre into the ear canal, and the second bend is a further 0.5 centimetre up to 1 centimetre beyond that. And beyond the second bend, we have the bony part of the ear canal, the osseous portion, and anything above, before the second bend is made up of cartilage. So between that first and second bend, we've got a narrowing, and quite often wax can get trapped there. So as the wax is migrating out of the ear, it can get trapped in that narrowing. And the second isthmus we have is about 0.5 centimetre away from the eardrum. The ear canal narrows, and you're going to see it in a moment. Well, not in a moment, it's another 7 or 8 minutes time. The ear canal narrows and it protrudes back out again, and so it balloons out. And if you get wax trapped and pushed in beyond that narrowing, it's filling up a space larger than that narrowing, so it makes it much more difficult to remove. So it's the fact that it's impacted up against the eardrum beyond this isthmus. And also because this part of the ear is so sensitive, guys, I can't stress that enough. A fourth reason is because this patient's ear canal is really, really narrow as well. It's a very narrow channel. And I'm going to give it a fifth reason. I forgot how many reasons now. Sounds like I'm trying to justify myself, doesn't it? But the roof of the ear canal itself is swollen. And because it's swollen, you'll see it again in a moment, just on top of the suction probe here. And it's swollen and engulfed itself around the wax plug. So this is trapped. We're trying to bring it through. But the main reason is it's because of the location. It's on the bony part of the ear canal. This part of the ear is so sensitive, and the best way I can describe it is if anyone has had an exposed nerve in their tooth and they drink something cold, that stinging effect, a really sharp acute pain. And if I make solid contact with the bony part of the ear canal. Now, this is the first entry of the ear pick. I'm trying to get it in underneath, but there's just not enough space, and instead you can see I'm just pushing it further in. So I'm going to go back to the suction and bring it forwards again. And the patient's mum was sat right behind me, so she had a perfect view. And I did promise I'll upload this today so they can see it. So you can see I've managed to get an okay suction grip up to this point, but here there's some resistance. So I advise the patient what I'm going to try and do is flip this plug of wax over. So this bottom section, if I can bring it up and the top section down, you're realigning the wax within the canal wall, and that may then allow it to be removed. A good analogy of that is when you're trying to move a sofa, I don't know what it's called in America, a couch, settee, from one room to the other. And of course the couch, settee, sofa is larger than the door frame. You're going to have to angle it. You're going to have to move it in a certain orientation. So this is the second attempt, but again, it's just going to push it in. So at this point, I was quite disappointed with the ear pick. I thought, wow, spent all that time, effort developing it, but it's of no use at the moment. But it does come up trumps. Just hang on in there. Now, you may ask, why don't I use forceps? Well, there's nothing really, you've got a little bit there to grab onto, but this ear canal is so narrow that you put the forceps in, it's going to obscure most of the view, and that bottom jaw is going to probably clip the bottom of the ear canal, the bony part. Using a traditional ear hook, again, where am I going to put this through? The hook, the shape and geometry of it is going to mean some part is going to come in contact. Now, I have developed a new ear hook where it's tapered, but even in this ear, that hook would have been limited. I wouldn't have been able to really make use of it. Of course, the jobs are correct. It's not going to be suitable. It's just too deep. You're not going to get behind adequately. So I'm almost kind of giving up at this stage. I'm going to have to get this patient back after using drops. And it's very rare that happens. In fact, it's been a long time since that's been the case. And when I first started, I used to get patients back in quite regularly, and I'm not ashamed of it. And anyone who's new to earwax removal, again, you shouldn't feel that if you're having to get patients, okay, if you're getting in a high volume of patients twice, and yeah, I mean, I think it was probably maybe 15% of cases when I first started. But of course, with practice and experience, you just you're going to get better at what you do, and you need to be doing it regularly. I haven't played snooker for a while, but in America, we call it, pool is slightly different, but it's like golf, for example, or darts. It's something that you have to do on a regular basis to keep your skill level up. And it's the same with earwax removal. There's no shying away from that. So again, I'm just trying to lift it up. I've just put some more olive oil in here to see if I can just lubricate it. So oil sometimes works as the substitute for soap. If you've got a ring stuck on your finger, putting a bit of soap around that can help lubricate it. Now, fortunately, this patient wasn't experiencing any otalgia or pain. If this was keratosis obturans, which is not, and the reason why it's not is because there's no global expansion of the ear canal. So it's not, this is self-inflicted. I mean, this could have developed into keratosis obturans, don't get me wrong, but this is probably more wax than dead skin. Keratosis obturans is an accumulation of dead skin that's failed to shed properly out of the ear. So this is where the ear pick comes in. So I'm just going to where that swelling is, and I'm going to penetrate in. I've got to be careful. We don't know where this eardrum is. I don't want to penetrate that. Now, I think the ear pick is going to have to be used by really experienced professionals because it is got a sharp edge at the end. Similarly to the ear hook, but because of the pointed part of the ear pick is going towards, there's an angle there, there's a curve there, but it's with the ear hook, it's a 90-degree bend. With the ear pick, it's not. So I managed to leverage it out, the wax plug on the opposite side, which created an opening on the roof of the ear canal to the right at 1 o'clock. And it was a small opening, and I would have struggled with an ear hook, but with the ear pick, it was absolutely perfect. Now, the instruments that I've developed, they are reinforced with carbon fibers, so they are extremely strong. I was playing around with the instruments yesterday in a mannequin, and I put blue tack, really lodged it deep in the ear. And I also put a battery in there, hearing aid battery that was stuck, and I was almost trying to break the instrument just to see how much strength it's got, and it just wouldn't break. The instrument is also half the weight of other instruments that I commonly use, but even stronger, so we've come up trumps there again with that, I think. So this is a bit of a close-up of the tip of the the ear pick, and you can see that wax, just how dark it is. It's oxidized. It's darker than the instrument, actually. And then I've just taken more of a zoomed out view. You can see the bend there, the handle design that we've done for better friction and grip and rotation. Well, I hope you enjoyed that video, guys. And the patient's mum ended by saying that she's smiling ear to ear, and she asked me to put that on the video somewhere, and I'll use that as a title. Thank you, bye.